Okay, good morning, everyone. Thank you so much for joining us for our second session of our 2021 Virtual Benefits Fair. We are so glad that you could join us today. Um, I am Kimberly Williams, the Assistant Town Manager, and joining me today with hosting duties is Jessica Rojas, our HR Generalist, and also representing our HR department is Tracy Lavoy, who is our Payroll and Benefits Specialist. I would like to remind everyone that today's session is being recorded for our team members who are unable to join us today, or should you wish to view this session at a later time. Each of the presenters during our virtual fair will make a brief presentation and then open the session up for questions. So with that, I will get started. Joining us today from Blue Cross Blue Shield of Massachusetts, one of our longtime vendors is Courtney Daniels. She is fantastic and she's going to share a lot of important information for us today. So I will get out of the way and turn the session over to you, Courtney.
Thank you, Kimberly. Hi, everyone. Again, my name is Courtney Daniels, and I am here today to present your 2 medical plan offerings with Blue Cross Blue Shield of Massachusetts. Okay. So on today's agenda and throughout this presentation, I will be going over the specifics of each of the plan offerings. The Blue Care Elect deductible with Hospital Choice Cost Share, also known as the PPO benchmark plan, and also the Network Blue New England deductible with Hospital Choice Cost Sharing, also known as the HMO benchmark plan. I will take any questions that you may have at the end of the presentation. But to start, this is your open enrollment period, and please note that any of your benefit elections will be effective as of July 1st, 2021. You can choose to enroll in either of the 2 Blue Cross Blue Shield medical plans, and all your dependents are covered through the end of their 26th birthday month, and there are no waiting periods and no pre-existing condition limitations to join these plans. First, we'll go over the benefits under the Blue Care Elect deductible with Hospital Choice Cost Share, otherwise known as the PPO benchmark plan. This medical plan is PPO, which means Preferred Provider Organization. These types of plans give you the freedom to choose any doctor or hospital nationwide. Although we do encourage you to have a doctor to call when you're sick or not feeling well, under a PPO plan, we do not require that you have a primary care physician, and you do not need referrals to see specialists. So you will decide where you receive your care. It is important to remember that where you choose to go will determine the level of benefits that you receive. You will pay less for in-network services than when you go out of network under this plan. To receive in-network benefits, you must use providers who are in the National Blue Cross Blue Shield PPO preferred network or any hospital emergency room. To find Blue Cross Blue Shield PPO providers, you can call us, you can visit our website, or you can simply ask your provider if they're in the PPO network. If you choose to see a provider who's not in network, you are still covered under this plan, but it will be at the out-of-network level. Also, please note that for out-of-network services, you can use any licensed provider, but they may balance bill if they charge more than the Blue Cross Blue Shield allowed amount for services. So first, we'll look at your in-network level of benefits. So for some benefits, you will have to meet a deductible before the plan will begin to pay. I have noted the services in red on the slides that you need to meet the deductible first. The deductible is $300 for each individual member and does not and will not exceed $900 for a family. Let's see. Your plan year runs from July 1st through June 30th. Your in-network routine health checkups are covered in full. Visits to primary care for sick visits, visits to specialists, visits to physical therapy, speech therapy, cardiac rehabilitation, those are all covered without having to satisfy the deductible. They're just covered at a copay amount. The copayment, let me just see, the deductible also does not apply to urgent care visits. So you will have to satisfy the deductible for emergency room visits. So after that deductible has been met, there's a $100 copayment for those visits. You may save money again by going to an urgent care because you will just have to pay the $60 copay and not have to satisfy the deductible. You will pay a 20% coinsurance after the deductible for in-network durable medical equipment and prosthetic devices. And for in-network lab tests and for in-network lab tests and x-rays, you will have full coverage after the deductible has been met. For in-network high-tech radiology, which is MRIs, PET scans, CT scans, and nuclear cardiac imaging, you'll pay nothing at standalone facilities such as Shields MRI, or you will pay a $100 copay per category of test after the deductible has been met if it's done at a hospital. Oops, sorry, I just clicked the slide button by accident there. I apologize. So for some, just back to my notes here, I apologize. So after you've met the deductible, you will be responsible for a $250 copay for any hospital day surgery that you may have. And then in purple on this slide, I've noted where the hospital choice cost share feature comes into play. So we will go over this more in the next two slides, but basically, if you go to a lower cost hospital for your inpatient care, you'll pay a $500 copay once your deductible has been met. Or if you go to a higher cost hospital, you'd pay a $1,500 copay after your deductible has been met for those services. Blue Cross Blue Shield of Massachusetts contracts with Express Scripts to manage our pharmacy benefits. Through Express Scripts, we contract with most major chains and local pharmacies. For prescriptions purchased at a retail pharmacy, you'll receive a 30-day supply. For Tier 1 generic medications, you pay no more than $10. For Tier 2 preferred brand name medications, you pay no more than $30. And for Tier 3 non-preferred brand name drugs, your copayment is $65. For your monthly maintenance medications you take on a regular basis, you may be able to get a 90-day supply at one time through our designated retail pharmacy or mail order pharmacy benefit. You can save money buying prescriptions this way because you pay the equivalent of 2.5 copayments for each 90-day supply instead of 3 copayments. So for Tier 1 and Tier 2 medications, for Tier 3 medications, you through the mail or the Smart 90 program, you'll pay $30 less for a 3-month supply. Be sure to visit the pharmacy coverage area of our website. There's a $9 mail order prescription list there for you to see if your prescriptions fall in that category. And there's other valuable information about your pharmacy benefit there as well. So as I mentioned on the previous slide regarding inpatient admissions, here's a look at the HCCS or hospital choice cost sharing benefit and how it works. So understanding this will help you get the right care at the right price and help you avoid unexpected cost. So all of our Massachusetts hospitals have been grouped into two cost sharing tiers, higher cost and lower cost. So some hospitals, and this is important to know, they can charge different amounts for the same benefits. So this hospital choice cost sharing was based on that simple fact. So when you need care, the hospital where you receive your care will determine how much you'll pay out of pocket. And you may pay more at the higher cost share hospitals. You will always pay the least for quality care when you go to the lower cost hospitals. In case of an emergency, don't worry about where you go. Go to the nearest hospital because emergency room visits will cost the same no matter which hospital you're at. And all hospitals outside of Massachusetts fall into the lower cost category. So this is a list of all the 8 higher cost hospitals in Massachusetts. So again, if you go to any one of these 8 hospitals, you will pay a higher copay. And after your deductible is met at any of these hospitals, your copay would be $1,500. And after your deductible has met, it would be $500 at any other Massachusetts hospital. So the PPO again has the out-of-network level of benefit available to you. So for out-of-network services, the deductible is the same as the in-network deductible. It's $300 per member, not to exceed $900 per family, and they do cross-accumulate. So once your plan year deductible has been met, you are responsible for 20% coinsurance for most out-of-network services. The emergency room copayment is the same as the in-network. So it's $100 after deductible. For out-of-network prosthetics and durable medical equipment, you will pay 40% coinsurance after the deductible has been met. And for retail prescription drugs purchased at a pharmacy that does not participate with Express Scripts, you will be responsible for all charges. Out-of-network pharmacy and prescriptions are not covered under the PPO plan. So please note that the amount the PPO plan for covered services is based on Blue Cross allowed charges. And again, if you see an out-of-network provider that costs more than our allowed amount, you may have to pay the difference. That's also known as balance billing. So you are protected by an out-of-pocket maximum. This is the most you will pay each plan year for co-payments, deductible, and coinsurance. This amount is $2,000 per individual and $4,000 for the entire family. It does exclude prescription drugs as there is a separate out-of-pocket maximum for prescription drugs. The most you'll pay each plan year for prescription drug co-payments is $3,000 for one member or $6,000 for the entire family. Next, we'll go over the benefit details of the HMO Blue New England deductible with hospital choice cost share, otherwise known as the HMO benchmark plan. Benefits are available for services you receive from network providers under this plan. So the HMO Blue New England network includes hospitals in all 6 New England states and most of the doctors. Each family member chooses a primary care physician or PCP, and you can change that doctor at any time. Your PCP will refer you to a network specialist when you need specialty care. However, you don't need referrals to see a network OBGYN, an outpatient behavioral health specialist, chiropractors, acupuncturists, or for routine vision exams. Just be sure to choose an HMO Blue New England network provider for those services. And again, in an emergency, go to the nearest hospital emergency room for treatment. If you are traveling or have a student attending a school outside of New England, you are covered for emergency or sudden illness anywhere in the world. To find participating HMO Blue New England providers, you can visit our website, call us, or ask your provider if they're in the HMO Blue New England network. So even though this is a deductible plan, you will see that some services are not subject to the deductible. You simply pay nothing or you pay a copay for those services. So routine health checkups are covered in full, including related preventative tests. Routine health checkups include annual routine physicals for adults and children, your annual gynecological exams, and routine vision exams once every 24 months. The copayment for diagnostic office visits to your PCP, OBGYN, or for behavioral health visits and speech and physical therapy is $20. You don't have to satisfy the deductible for that. And a diagnostic office visit is when you visit a doctor to treat, diagnose, or monitor a medical complaint or condition. There is a $60 copayment for visits to specialists such as cardiologists or endocrinologists. For some benefits under the HMO Blue New England deductible plan, you have to meet the deductible before the plan will pay. Those services are noted in red on this slide. The deductible is $300 for each member, each plan year, but no more than $900 for family. Emergency room visits are subject to the deductible and a $100 copayment. This copayment would be waived if you are admitted to the hospital. You can save money by visiting an independent freestanding urgent care center and pay just the $60 copay and not have to satisfy the deductible. You will pay 20% coinsurance after the deductible for durable medical equipment and prosthetic devices. And for diagnostic lab tests and x-rays, you have full coverage after the deductible. For high-tech imaging such as MRIs, PET scans, CT scans, and nuclear cardiac imaging, you have to pay a $100 copay per category of test per date of service. Again, this would be after the deductible has been satisfied. And for hospital day surgeries after the deductible, there's a $250 copayment per admission. And again, as in the PPO plan, in purple on this slide is where the HCCS or hospital choice cost share feature comes into play. So if you go to a lower cost hospital, your copayment after your deductible is met is $500. And if you go to a higher cost hospital, your copay would be $1,500 after your deductible has been met. So again, under this plan, we contract with Express Scripts to manage our pharmacy benefits. For prescriptions purchased at a retail pharmacy, you will receive up to a 30-day supply. For Tier 1, you pay no more than $10. For Tier 2, pay no more than $30. And for Tier 3, your copay is $65. And again, for your monthly maintenance medications you take on a regular basis, you can save money by obtaining a 90-day supply through mail order or at a designated retail CVS pharmacy under the Smart 90 program. And under the HMO plan, you are protected by the out-of-pocket maximum amount. So the most you'll pay each plan year for copayments, deductible, and coinsurance is $2,000 per member or $4,000 for the entire family, excluding prescription drugs. There is a separate plan year out-of-pocket maximum for prescription drugs, which is $3,000 for individual or $6,000 per family. If you're enrolled in either of those plans, you have access to care through our Well Connection plan, otherwise known as telehealth. Well Connection allows you to connect in real time through a video visit for medical and behavioral health services using your smartphone, tablet, or computer. Well Connection visits cost members the same as any in-network office visits. It allows you to be able to access credentialed doctors and therapists for non-urgent care in fast and convenient manner from wherever you choose. All Well Connection doctors are in-network and can prescribe medication, diagnose, and treat members. Blue Cross Blue Shield of Massachusetts partners with American Well to offer Well Connection benefits. You can sign up for Well Connection at www.wellconnection.com. And the Blue Cross Blue Shield health plans can save you money annually when you participate in a qualified fitness program and or a qualified weight loss program. For the fitness reimbursement program, you are eligible for one reimbursement per family each calendar year for up to $300 for membership at either a full service health club or fitness studio in person or virtually, which is new, effective July 1st, 2021. For the weight loss reimbursement program, you are eligible for one reimbursement for family each calendar year for up to $150 for any weight loss program that combines healthy eating, exercise, and coaching sessions with certified health professionals. How do you get reimbursed? You can simply submit for reimbursement online or download the form and mail it to us. You can download the free MyBlue app or go to our website, which is bluecrossma.org/myblue, and register for a MyBlue online account for a personalized way to access your healthcare information, claims, and more, such as you can confirm who's covered under your plan, you can view and order new ID cards, you can access your medical plan summary and subscriber certificate for complete details of your plan, and you can view your claims and deductible accumulations. And this slide explains some added benefits to our Blue Cross Blue Shield members. Looking for a deal, you can visit the blue365deals.com. Blue 365 brings Blue Cross Blue Shield members page after page of deals and discounts from top health and wellness retailers around the country. You can visit healthyme.com for everything you need to live a healthier life. Healthyme.com provides you access to information and tools related to health, nutrition, and well-being. If you're pregnant, you can prepare for pregnancy, labor, and delivery by visiting livinghealthybabies.com. Calculators, nutrition articles, and online resources are available for Blue Cross Blue Shield members. There's also texting support for expecting parents through Text for Baby by texting the word baby to 511-411. And lastly, just know that we are here to help. So if you need provider information or wish to speak with a Blue Cross Blue Shield team member about your membership benefits or claims, please call Team Blue between 8 a.m. 6 p.m. Monday through Friday, or visit bluecrossma.org and chat with us using the Ask B chat feature. Medical advice from a registered nurse is available 24 hours a day by calling our Blue Care line toll-free number. There's no charge for this service, and our members who call the Blue Care line have eliminated many unnecessary emergency room visits. You can use the Well Connection benefit for your video visits with a doctor using your smartphone, tablet, or computer. And you may visit our web anytime and even email Team Blue by using an online secure inquiry form after you register for your MyBlue account. And this completes my presentation. I thank you for listening. And at this time, I will take any questions that you may have. I can hand this back over to Kimberly Williams or Jessica Rojas at this time.
So thank you so much, Courtney. So our session, we have a few minutes left, so we are opening up for questions. Please unmute yourself, or you can type a question into the chat. And any questions that you'd like to ask? Courtney is the expert, so this is the best time to get your questions asked. So we do have one question, Courtney.
Okay.
They would like to confirm if Dexcom G6 glucose monitoring system is covered under Blue Cross Blue Shield.
Sure. I believe it is. I can look into that for you. That would just take a few moments. So I can look into that and I can let Kimberly know by email, and
Perfect.
then she can get back to you with the answer. But I'm pretty sure I've looked up that before and it is a covered benefit.
Okay, thank you.
Perfect. We have time for one more question. So can we print out the slides? So Courtney was great enough to provide us her presentation. So that information will be available to you on our HR page later today.
Can I ask a question, Kim?
Absolutely. We have Chief McDermott.
Courtney, good morning.
Good morning.
What would the comparison be for Blue Cross Blue Shield with Blue Cross Advantage or Advantage Blue? Is there similarities to this package?
Let me just look here. So for the Advantage Blue is a that's actually, it takes over or replaces your Medicare. It's a Medicare replacement plan. So it doesn't really compare. It does compare, but it's different benefits. So I'd have to actually look at that plan to.
Okay, I'd be looking to switch from my wife's current plan to a town plan. Could I also add one more question into this? If
Sure.
you were looking at retiring, do you have to be on the insurance prior to retiring, or you can go on the insurance at any point after the fact?
That would be something that Jessica may be able to answer, or Kimberly. Do they have to be on the insurance when they retire to enroll in your retirement plan, or?
They can stay on our insurance and once they're retired and be eligible for MedX once they're 65 years old.
But if
No,
they're
I-
not currently enrolled on the insurance, can they?
They can enroll during open
Okay.
enrollment prior to retirement, yes.
Perfect.
So is it only on open? There are also not extenuating circumstances, so
Yes, retirement is a qualifying event in order to enroll. If you have a qualifying event during the year, you can enroll. If you do not have a qualifying event during the year, you would have to wait till open enrollment.
okay, and the qualifying events will be listed on our HR website.
Yes.
Thank you. I see you keep turning around and looking. I'm just wondering who you're looking at.
Ms. Daniels?
Is there any other questions?
Yes, I have a question, ma'am.
What's your question?
I'm a retiree. And what vendors cover the vision and hearing?
Okay, let me just bring up that benefit. Sorry. What plan are you currently on?
I really don't know.
Okay, and this is because it depends really on the plan. So I'm going to look you up real quick. Is it Walsh? And what's your first name?
Roderick, Roderick.
Sorry, my system is taking a minute.
We do have only 2 minutes left. We have to end this at 11:30 to go on to the next session.
Sorry, I might have to actually look that up and get the answer to Jessica and Kimberly, just because my system is going so slowly right now, but
Okay, thank you very much.
you're welcome.
Is there any other last minute questions before we end the session? Okay, well, thank you all of us for meeting with Courtney today. And as Kimberly previously stated, this is being recorded and it will be uploaded to the town's website later on today. Thank you, everyone.
Thank you.